Good morning everyone. The topic which we'll be discussing today is aphasia. Aphasia, as we all know, means a language disorder due to the damage of the language areas of the brain. Language areas are nothing but specific areas of brain which command the understanding and production and expression of words. Aphasia can be classified in various ways. A simple way to classify aphasia is fluent and non-fluent aphasias. Fluent aphasias are where the patient speaks fluently, continuously, without stammering, without stuttering or broken speech. But however, the comprehension or the meaning of the sentences and words which he speaks doesn't make sense to the others. There are various types of fluent aphasias. The most common ones are the Wernicke's aphasia and the transcortical sensory aphasia. The milder versions of the fluent aphasia are anomic aphasia and conduction aphasias. The other type of aphasias, which as I told you, is the non-fluent aphasia. This affects the Broca's areas of the brain, which is nothing but the area which control the production of word or expression of words. Hence, this type of aphasia is also called the expressive type. The predominant type of non-fluent aphasia is Broca's aphasia. The other types are the transcortical motor aphasia or global aphasia, where in global aphasia both the language production and language understanding, and there is a total disruption of speech and language of the patient. So, what are the common causes of aphasia? The most common cause of aphasia is stroke and head injury. However, infections and neurodegenerative conditions and brain tumors or a patient following surgery can develop aphasia, and this occurs more so when the pathology or the disease process is involving the language dominant area of the brain. In predominantly say 70 to 80% of the population, the language dominant area of the brain is on the left side. So how do we diagnose aphasia? Aphasia by symptom wise, the patient or the patient's relatives themselves know that there is a change in his speech, there is some stammering, there is some grammatical or syntax error, and it's easily made out by the patient's relative. But however, when the patient comes to the clinic, a detailed neurological examination by the neurologist and the speech and language pathologist can easily identify an aphasia by conducting a panel of tests, by asking him to name objects, repeat objects, writing, reading, and there are a panel of tests which can be conducted to identify speech or language disturbance in the patient, and this we term as aphasia. And of course, to identify the disease process per se, CT scans and MRIs can be done, which lets us know whether it is a stroke or an infection or due to a head injury or any other various pathologies which could affect and cause aphasia. And also, functional MRI techniques and PET scans helps to identify or map the areas of brain which are concerned with aphasia. So once say we diagnose patient with aphasia and he has a brain tumor, and before surgery we get a mapping of his language areas using functional MRI techniques, we can be more careful and we can perform an awake craniotomy during surgery so that we can preserve the language areas after surgery. So once we have diagnosed it, and how do we go about treating aphasia? The primary treatment of aphasia is the treatment of the primary disorder itself. If it is a stroke, we have to treat the stroke. If it is an infection, and head injury, any hematomas, contusions, or an extradural hematoma which is causing aphasia has to be treated first. And the neurologists come into picture when it is a neurodegenerative condition like an Alzheimer's disease or a progressive supranuclear palsy and other neurodegenerative conditions and dementias. So once the treatment of the primary condition is being done, it has to be followed by a rigorous speech and language therapy. Patient has to be taught various non-verbal modes of communications like gestures, using pictures, using a tablet or a cell phone or a laptop or a computer so that he can communicate effectively. And safety is important, because if you're not able to communicate, even in in times of danger, you'll not be able to communicate. So it is very important that the patient and the patient's relative learn about this non-verbal modes of communication for effective communication in the patient of aphasia. Even though the patient undergoes a rigorous speech and language therapy, the further progress depends on various factors. It may be the age of the patient, the pre-existing medical illnesses, the extent or the damage which has been caused by the disease pathology, and the patient motivation, the patient's education status. All these come into picture when it comes to the recovery of the patient. However, in spite of rigorous speech and language therapy, full effort from the healthcare giver and full family support, 100% recovery of speech and language is sometimes typically not possible. So he has to continue the speech and language therapy and gain a potential to use non-verbal modes of communication, so that he can lead a better life and he can communicate effectively with his loved ones. Thank you.